Cancer, it's a word that can strike fear into anyone's heart. But understanding what cancer is can really be the first step in taking control. Simply put, cancer is a disease where cells grow uncontrollably. Our bodies are constantly making new cells to replace old ones, but cancer cells just don't follow the rules. They grow and divide too quickly, forming a mass of tissue called a tumor. Cancer is actually more common than you might think. Millions of people around the world are diagnosed with it each year. There are many different types of cancer, each named after the part of the body where it starts. Some common types include breast cancer, lung cancer, prostate cancer, and colon cancer. Cancer can spread from its original location to other parts of the body through a process called metastasis. This happens when cancer cells break away from the tumor and travel through the bloodstream or lymphatic system to other organs. While the word cancer can be scary, it's important to remember that there is hope. Advancements in cancer research and treatment have made it possible for many people to live long and healthy lives after a diagnosis. Cancer can manifest in many ways, and the symptoms can vary depending on the type and stage of the disease. Some common warning signs include unexplained weight loss, persistent fatigue, unusual bleeding or discharge, skin changes, and persistent coughs or hoarseness. It's important to remember that experiencing these symptoms does not automatically mean you have cancer. Many other conditions can cause these symptoms, so it's crucial to consult a doctor for a proper diagnosis. Several factors can increase your risk of developing cancer. Some risks, like genetics, are beyond our control. A family history of cancer can significantly increase your chances of developing the disease. Other risk factors are linked to lifestyle choices. Smoking is a major risk factor for several types of cancer, including lung, throat, and bladder cancer. A diet low in fruits and vegetables and a lack of physical activity can also increase your risk. Exposure to certain environmental factors like radiation and certain chemicals can also contribute to cancer development. It's important to be aware of these risk factors and take steps to minimize your exposure whenever possible. Remember, knowledge is power, and understanding your risks can empower you to make healthier choices. If you experience any unusual or persistent symptoms, it's essential to see your doctor as soon as possible. Early detection is crucial in cancer treatment. Diagnosing cancer involves a series of steps to determine the presence, type, and extent of the disease. Your doctor will start by reviewing your medical history and conducting a physical exam. They may then recommend imaging tests like X-rays, kinetic scans, or MRIs to get a closer look at the suspicious area. A biopsy, where a small sample of tissue is removed and examined under a microscope, is often the definitive way to diagnose cancer. Once cancer is confirmed, the next step is staging. Cancer staging describes the size and extent of the tumor and whether it has spread to nearby lymph nodes or other parts of the body. Staging helps doctors determine the best course of treatment and predict the likely outcome of the disease. The most common staging system uses Roman numerals from 1 to 4, with stage 1 being the earliest and stage 4 indicating that the cancer has spread to distant organs. Understanding your diagnosis and stage can feel overwhelming, but your healthcare team is there to guide you every step of the way. Treatment for cancer varies depending on the type, stage, and overall health of the patient. Common treatment options include surgery to remove the tumor, chemotherapy to kill cancer cells, radiation therapy to destroy cancer cells using high-energy rays, and immunotherapy to boost the body's immune system to fight cancer. Each treatment comes with potential side effects, which your doctor will discuss with you in detail. Managing the physical and emotional challenges of cancer and its treatment is crucial. Maintaining a healthy diet, engaging in regular exercise as tolerated, and getting enough rest can help you cope with the demands of treatment. Don't hesitate to reach out for support from loved ones, support groups, or mental health professionals. Remember, you are not alone in this journey. Communication is key throughout your cancer journey. Don't be afraid to ask your healthcare provider questions about your diagnosis, treatment options, potential side effects, and what to expect. Some important questions to ask include: what type and stage of cancer do I have? What are my treatment options? What are the potential risks and benefits of each option? What can I do to manage side effects? What is the long-term outlook for my situation? Advances in cancer care are constantly being made, offering new hope for patients. While the journey may be challenging, remember that there is always hope, and a positive outlook can go a long way.